Hi, Natalie. So, after reviewing your symptoms, we have discovered that you have tetanus. So, this would explain the high blood pressure that you have, or hypertension, your elevated heart rate, and especially the stiffness that you've been feeling in your neck. Those are all common symptoms of tetanus, and you most likely contracted this from the lesion on your foot that you got while hiking barefoot in the Junior Ranger program. Tetanus bacteria are commonly found in soil or dust, so that would have been a likely possibility. Now, there is no direct treatment for tetanus, but the symptoms are manageable. So the reason for this is when the tetanus bacteria enter your body, they attach to the nerve cells and they compromise them. So the infection can't be fully gotten rid of until new nerve cells generate, which usually takes about 6 months. So you won't have a full recovery before then. However, we have ways of managing your symptoms. So the first and most important thing is wound care. So making sure that there are no more foreign bodies in the wound, cleaning the dirt out of it, and removing any dead cells. And see, this is important because if there are any remaining bacteria in the wound, we don't want them to enter your body, and we don't want any bacteria on the outside to have a way to get in. And now the other part of your treatment, which might be a bit more controversial, is I understand that your parents have wanted us to discontinue the medication. However, I would ask both them and you to consider how serious an illness this is. With treatment, your prognosis is extremely good. However, gone untreated, tetanus can be extremely dangerous and possibly even fatal. So with that in mind, the course of treatment that we would recommend is tetanus immune globulin, which will help to get rid of the bacteria that haven't bonded to nerve tissue yet. We would give you a tetanus vaccine, which is recommended for all patients diagnosed with tetanus. And we could give you sedatives such as morphine to control your muscle spasms and antibiotics to control the bacteria. Now, there isn't a 100% guarantee that any of these things will work. However, in past patients, we've had very high success. So, and of course, with drugs such as morphine, we want to be extremely careful not to overuse, otherwise addiction is a possibility. However, we feel that with treatment, your prognosis is extremely good. So I urge you and your parents to consider these options and just to remember the gravity of this situation and what could happen if this disease is gone untreated. So hopefully we'll have you all better in somewhere around 6 months.